Your skull is cracked open. You are fully conscious. No anesthesia, no sterile equipment, just stone. And somehow you survive. This was not a horror story. This was medicine. And it happened far more often than you think. For most of human history, sickness and injury were not abstract risks. They were constant companions. A broken bone, an infected wound, a difficult childbirth, a sudden fever. Any of these could comfortably end your life by Thursday. And yet your ancestors did not simply wait to die. They experimented. They observed. They developed treatments, some of which were shockingly effective, and some of which were almost unbelievable by modern standards. Let's start with the procedure that sounds the most impossible: trepanation. The deliberate drilling, cutting, or scraping of a hole into the human skull while the patient was still alive. Archaeologists have found trepanned skulls on every inhabited continent, with some of the oldest examples dating back over 7,000 years found at Neolithic sites across Europe. What makes this discovery remarkable is not just that the procedure happened, it is that many of these skulls show clear evidence of bone regrowth around the edges of the hole. The patient survived, sometimes for years. Bioarchaeologist Francesco Galassi has studied trepanned skulls extensively, and his analysis suggests survival rates that are difficult to reconcile with how primitive the tools and conditions were: sharpened stone, obsidian, or flint blades. No germ theory. No anesthesia beyond perhaps alcohol, certain plants, or simply being held down by your closest friends. And yet, in many regions, the survival rate for trepanation appears to have been startlingly high. In some studied populations, the majority of patients lived. Why would anyone do this? The reasons likely varied. Some trepanations align precisely with the location of skull fractures, suggesting the procedure was used to relieve pressure from traumatic brain injury. This is a treatment that in modern neurosurgery is still performed for the exact same reason. We just call it a craniotomy and charge a lot more for it. Other cases show no trauma at all, suggesting the procedure may have been used to treat severe headaches, seizures, or what ancient people understood as a buildup of bad spirits inside the skull that desperately needed a backdoor to escape. Your ancestors did not have brain scans, but through trial, error, and careful observation passed down across generations, they arrived at a surgical solution to a real medical problem, one that medicine would not formally rediscover for thousands of years. So they could survive brain surgery with sharp rocks. But what did they do for a toothache? Consider dentistry. At a Neolithic graveyard in Mehrgarh, in what is now Pakistan, researchers led by archaeologist Roberto Macchiarelli discovered teeth with small, precisely drilled holes dating back nearly 9,000 years. The drilling shows rotational marks consistent with a bow drill, the exact same basic mechanical principle used to violently rub sticks together to start fires. Someone identified dental pain as a treatable condition, looked at a fire-starting tool, and thought, I should put this inside someone's mouth. And it worked. Then there is splinting and bone setting. Skeletal remains from numerous prehistoric sites show healed fractures that were realigned correctly before healing, meaning someone understood that a broken bone needed to be set straight, immobilized, and given time, or it would heal crooked and useless. This required real anatomical knowledge, accumulated and transmitted across generations of people who had no written language to record it. Let's reconstruct a scene. Imagine a small encampment roughly 30,000 years ago. A hunter has fallen and broken his leg badly enough that the bone is visibly misaligned. The group does not abandon him. An older member of the group, someone who has set bones before, who learned from someone who set bones before them, examines the leg. They pull the limb straight, against the hunter's screaming protest, and bind it tightly with wet leather strips that will harden as they dry, creating an early form of a cast. For weeks, the group slows its movement, or leaves food behind, to accommodate his recovery. This was not just medicine. It was a society organizing itself around the survival of an injured member, a level of cooperative care that very few other species on Earth display. So ancient humans were remarkably good at fixing bones and teeth. But what happened when they tried to turn literal garbage into medicine? Things got incredibly weird. When we think of ancient Egypt, we think of architectural genius and mathematical precision. We do not usually think of animal feces. But the Ibers Papyrus, a massive Egyptian medical text dating back to 1550 BC, is packed with remedies that heavily feature dung. Donkey dung, pig dung, crocodile dung. If an animal made it, an Egyptian physician probably tried to cure a disease with it. Crocodile dung, for example, was used as a primary method of birth control. Women would mix the dung with honey and fermented dough to create a pessary inserted before intercourse. It sounds like absolute madness. It sounds like the fastest possible route to a horrific infection. But here is the uncomfortable truth. It kind of worked. Crocodile dung is naturally alkaline. When mixed with the lactic acid of fermented dough, it altered the pH of the reproductive tract just enough to act as a crude natural spermicide. Plus, the physical mass created a literal roadblock for sperm. They were treating a complex biological problem with chemistry, even though they had absolutely zero understanding of the molecules involved. They also applied animal dung directly to open wounds to ward off evil spirits. Now, this is where the survival rate definitely takes a hit, because tetanus spores absolutely love animal feces. But even here, there is a twisted logic. Certain animal microbiomes contain naturally occurring antibiotic substances. It was a massive gamble. Many certainly died. But in a world without pharmacies, you use whatever foul-smelling paste you can find, provided the guy before you survived it. And speaking of naturally occurring antibiotics, some ancient treatments reveal a sharp, if incomplete, understanding of the natural world. Ancient humans developed a vast pharmacological knowledge of plants long before anyone understood the chemistry behind why those plants worked. At a Neanderthal site in Spain called El Cedrón, researchers led by Karen Hardy found chemical traces in dental calculus, the hardened plaque on ancient teeth, revealing that Neanderthals had consumed yarrow and chamomile, two plants with no significant nutritional value but well-documented medicinal properties, including pain relief and anti-inflammatory effects. This was not random foraging. This was the deliberate use of plants specifically for their medicinal properties by a species often arrogantly dismissed as primitive. Then there is the mold. In ancient Mesopotamia, clay tablets describe treating infections by applying moldy bread directly to wounds. At the time, there was no concept of bacteria or fungi, but certain molds, the same family that would eventually give rise to penicillin, discovered formally by Alexander Fleming in 1928, do produce natural antibacterial compounds. Long before Fleming won a Nobel Prize, ancient healers had, through pure empirical trial and error across countless generations, stumbled onto a crude form of antibiotic treatment. They rubbed fuzzy bread into stab wounds and saved lives. Here is the counterintuitive twist. We tend to imagine ancient medicine as superstition layered over ignorance, leeches and chance and guesswork, and some of it certainly was. But underneath the rituals was a surprisingly rigorous, if informal, scientific process. Try something, observe the outcome, remember what worked, teach it. Repeat this process across tens of thousands of years, across millions of individual cases, and you get a body of practical medical knowledge refined by something close to natural selection itself. Except the thing being selected was not a gene, but an idea. What ancient humans lacked was not intelligence or curiosity. They lacked the tools to see what was actually happening at a cellular and microbial level. They could see that moldy bread helped a wound. They could not see why. They could see that a fractured skull, drained of pressure, sometimes saved a life. They could not see the swelling of the brain pressing against bone. Their medicine was built entirely on outcomes, observed patiently across lifetimes, without the underlying theory that would not arrive until the invention of the microscope and the germ theory of disease in the 19th century. You live in a world where you can walk into a building and have a tumor identified in minutes, an infection cured in days, a broken bone reset under anesthesia, and healed within weeks. None of that existed for the overwhelming majority of human history. And yet the impulse behind it, the refusal to simply let suffering go untreated, the patient accumulation of evidence about what helps and what harms, that impulse is exactly the same one driving the doctor who treats you today. Your skull, if it had been cracked open 30,000 years ago, might have been opened by someone with a sharpened stone blade and absolutely no formal training. But they cared enough to try, and there is a real chance you would have survived.